this gets into the next level of things, which is what we really care about, sleep disorders. So the biggest disorder that a lot of people have is insomnia. Your book talks about insomnia some on 331 and 332 and goes into it. What I want to talk about is kind of there are different conceptualizations of insomnia and the types you have. For me, one differentiation that really helps are basically the three types that some people believe. There's onset insomnia, maintenance insomnia, and termination insomnia. Onset insomnia is where you have trouble falling asleep. How many of you have some trouble falling asleep? I know I do sometimes. Maintenance insomnia is where you wake up a lot during the night and you keep waking up and waking up. Termination insomnia is where you wake up too early in the morning and you can't fall back to sleep. So these are huge problems. There are a lot of medications out there that can kind of be somewhat useful. Things like alcohol and Benadryl. We know that they're basically considered GABA agonists. They can help you fall to sleep, but if you look at the outline there, dependence can happen, and then you can lose REM sleep with them, and tolerance develops, and then when you go off them, it gets even worse. Barbiturates used to be used, and barbiturates also act at GABA receptors. Phenobarbital is an example of this, and they really sedate you, but they're very, very addictive as well. Benzodiazepines, Valium and Xanax, they basically help GABA bind better, and when GABA binds well, you basically get a chloride influx, and that makes people very sedative. Obviously, it's also used for anxiety. And then we actually have the Lunesta, Ambien, and Sonata game. What I'd like you to do is go onto the rxlist.com and type in clinical pharmacology on any one of these products and summarize what they do in terms of the pharmacology. Melatonin is also used, but not that useful. Some of you talked about that. I'd like you to also go in and with www.rxlist.com go and find out information about trazodone. Finally, the most important things, as box 9.1 says, sleep hygiene. Do not nap for a long time during the day. Avoid stimulants at night. Make sure the room is just used for sleeping, unless, of course, you're married, and so forth. Finally, some other disease states, apnea. Apnea is where you have periods where you fall asleep. You snore a lot when you sleep, and they do many times CPAPs for that, so look up a little bit on CPAPs, see if you can figure that out. Narcolepsy, where you have attacks of sleep during the day. That's where many times they give you amphetamines to increase norepinephrine and the locus coeruleus, which can be useful. And last but not least, epilepsy. Epilepsy is a disease where basically you fall unconscious. My daughter actually has epilepsy, and you fall unconscious, your EEG waves spike up, and they're out of control. Many times the products you take for epilepsy are GABA agonists to help GABA work better so that the seizures basically don't happen. Finally, what I'd like you to do here is I gave you some recommendations for homework. Go to the American Sleep Association, summarize 5 things there, and go to the American Academy of Sleep Medicine and summarize in a paragraph or so 3 interesting pieces of information about insomnia. Thank you very much for your attention, and that'll do it. Bye-bye.